Sorry, can you just quickly introduce yourself as well?
Yeah, Seamus Anderson from World Vision. Can you talk anything about the effect of extreme wealth on poverty eradication? So this week, Credit Suisse put a report out saying that the 1% now controls more of global wealth than the rest of the world put together. So I just want to, do you have opinions on that, on how that actually affects our vision to eradicate poverty?
Thank you. And just 2 rows behind here, please.
Catherine Buckle, I work at BBC Media Action. I was just wondering about the ageing population. So you can see that there's going to be a lot more older people as a proportion of the world population. So I was just wondering what you think the effect of that's going to be and what the problems that we are going to see in the future.
Thank you. So one question on inequality and one on ageing. Hans.
Yeah, can I have my image back? This is income distribution of all countries in the world, 1800, yellow Europe, green America, blue Africa, red Asia. This is extreme poverty, 190 as you know now. This is $10, this is $100. How it changed, and I'm showing now income because you asked about wealth. One of the main mistakes is that we confuse income from wealth. Wealth is extremely unequally distributed. Income is not in the same way. Because ordinary people, we all have incomes, otherwise we would die. But we use the income, we consume it, so we are not left with so much savings in the end of the year. But the rich people who have high income, they save almost everything, and they just get richer and richer. So first, to get the idea of the income, which is the most important. Wealth is for investments, income is for consumption. So here is what happened as years passed by, and in 1970s, we had this divided world. We had number of people increased in Asia and in Africa here, and then this was the poor and this was the rich. And of course, you had the very rich, so those you talk about, we don't even see them, they're back there behind you somewhere there, and they started to accumulate the wealth, and that just continues that way. But the income goes here. The important thing for me is that these people over here could help these one with investments, but they're too poor to give a return on capital. They won't do it, so we have to deprive them of their money, either by taxing them, or having them to become philanthropists, and join the Giving Pledge and put their money available in rational ways. And if we do that, then we get people out of extreme poverty. Look how many were in extreme poverty here, China and Africa. But this has happened now, as you knew. There's no 2 humps any longer. Still, we have this appalling amount of people in extreme poverty. Unacceptable. That can be pushed up here. This won't be solved by investments. It need roads, schools, and so on. This is where aid should focus, having read your report, investing in the future. The shame is that these people in the poorest countries get least amount of aid per people in extreme poverty. A lot of because of the push to remain aid and that stupid argument that most of the poor live in middle-income countries. That is just a distortion of how we measure purchasing power. We measure purchasing power in these countries on the basket that involves a lot of rich people, so they appear to be poorer than they are. Forget the poverty measure, look at fertility rates, look at maternal mortality, look at child mortality instead, and then you see where the extreme poverty really is. And then these people need, investment can take care of it from here. And taxation, which you showed very clearly in the social impact. So I'm coming back to your study all the time. But over here we need other investment. Yes, so deprive them of their money. Deprive them of their money and invest it. The problem of the world is that we have the money in the wrong place. The money are in few rich people in Europe and North America. And not investing in cement and roads, and piped water and agricultural, irrigation system where it's needed. The money had to go. And the best, if you want really to get, you have to have investment in Africa. Lots of money had to go there. I had the privilege of speaking in African unions, and Nkosazana Dlamini Zuma has a very good plan, and that's 2 or 3 zeros more than age, he says. The investment you need in Africa. And you have to offer that investment with return of capital. Otherwise they are greedy and they would keep it. But now they get better return of capital here than they get over here. So money should move away. But how do you stay politically stable here when the working class disappear over here? This is a real challenge of where that money will go. I spend lots of my time lecturing. Almost this lecture, same lecture I give to you, I give to the big banks, JP Morgan, Goldman Sachs, UBS. And because the investors want to know the same things. And they are actually, sorry to say, they are more knowledgeable, the bankers, about how many girls go to school, how many kids are vaccinated, because they are quants. They go for the numbers. It's called quants. And they really go for the number. They take away these emotions. Their problems is that to own the money, they have the old ideas. And they don't want to invest in Africa. We need to focus aid here. Then, of course, we need civil society. But it's the rich people in many countries. Look at China, for instance. Look at China here. There's China. That's the United States. See what an overlap it is. What an overlap today. Just going back to 1970, there was no overlap at all. The poorest in Mississippi, rural Mississippi, earned more than the Politburo in Beijing. Because they lived very modest at that time, stupidly modest. And then this happens. So we need to segmentize it also to see the aid money would help here, but here's where you get lots of corruption. Here you can't send any sort of volunteers. Here you need skilled professionals who know how to collaborate and how to operate. Really professional skill. And then you come over here, and from here on, I don't think you should have any aid. I have a rule in my secret law, never, about China and aid, never give aid to a country that buys Swedish car factories. And the second was about aging.
Aging.
Yes, and that is this one, which I didn't show you. It's this one here, and sorry, I changed this one to life expectancy. This is free on the web. You can use and play around with this. I can destroy your weekend. And here. And your relation, then also you will get very annoyed. And we put logarithm on this one. And I zoom it a little here. And I want to show, let me show, for instance, Bangladesh and United Kingdom. Where do we have United Kingdom? Should be up. I have to do it there. It's falling. So I'm taking them back in time. Look at the different trajectories. Bangladesh today have a life expectancy of 70. It corresponds to United Kingdom in the 1950s. That's why they have come. That's quite a success. And they have the same amount of money as United Kingdom had 1830 here perhaps. Isn't it fantastic? They are 120 years ahead in the health dimension compared to the economic dimension. So how should Bangladesh be able to take care of their old people that now needs hip replacement, cataract surgery, they need hearing devices, they need cancer operations? There's only one way of doing it. Fast economic growth for the next 30 years. I love money. Because you need money. You can't provide this. You discuss your wonderful NIH. It's just about the money. Without the money, you can't do it. Even the softer part of elderly care is qualified people who take care of old people. You can complement it. This is very dramatic. Look at all these countries here. I take away this, and then I put out there. Almost the entire world here are much healthier than UK was at the same economic level. Even my colleagues get carried away. They say, oh, health is so unequal. It's really a success. We, public health, we won over the bloody economists. This is where they failed. The wallet is the injustice of the world. The big inequality is not in health, it's in money. And you need to take care of old people, you really need more money. You can do wise analysis, you can start doing some things. Of course you can do that. Cataract surgery can be made, for instance, taking down blind people and disabilities. But it's an enormous challenge of being up here, when all these diseases exist. And also the challenge is, what should people do when grandma gets a cancer and she can be cured if they pay? It's one major reason for falling back into not only poverty, but extreme poverty, that you have to take care of your dear ones when they are old. And what policy should the country run? I hear this talk about equality, but it's very difficult to have equality in health service. Do you expect people in Tanzania to let their old people die in order to vaccinate the children in Sumbawanga, in the interior of the country? No. The highly qualified Tanzanian expect some sort of health service for them and increase their life expectancy. I cannot see that the countries who are worst off can have much more equality in health. All the groups have to improve. It shouldn't increase the inequality, but to decrease the equality and to avoid inequality, that's Pol Pot. That won't work. Taking glasses away from people, we have to live. It's a very dramatic situation that countries now get out of the diseases of poverty at a much lower economic level. And that's partly due to effective aid. That's partly due to these girls having gone to school at a much lower economic level. This country, United Kingdom, was so bloody unjust in this period. The kids were in the coal mines here. And this was very, very unequal here. Then came the health improvement after Jon Snow and cholera and so on, and it went up there. That was much later. We can see when that happened. That this period, first that the country just got richer, then somewhere, you see where we are? We are in the 1800s. It was ugly all the time, all the way through. Look at here, India, 67 years. The same as United Kingdom had after the war. And the amount of money they have is still down here. That's the challenge. Fast economic growth, which then should be taxed, of course, and which should be allocated wisely. But without the money, no justice.
Thank you. Right, let me take some questions from this side and at the back, just to mix things up a little bit. I've got one question at the very back there, and then one a few rows ahead in front. Thank you.
The children, there, and there. And some have mothers who are single mothers who are stigmatized and marginalized. I don't have them here, yes, but that data exists. Of course, we need a better mapping of poverty. I doubt that we'll get it by civil registration. One promising thing is take the last population census and take the use of cell phones and see where people exist who doesn't use cell phone. Go there. Mm-hmm. Don't have the illusion that everyone has cell phones. Some don't even have cell phone coverage because they don't have money, so who should cover them? Where the cell phone doesn't reach, that's the problem. We saw that during the Ebola epidemic in Liberia. Small little Liberia had huge areas without cell phone coverage. The teams who went there had to have satellite telephones. And there were villages that were 8 hours walking on paths that motorbikes couldn't pass. 8 hours. Make a road there. It's some very basic things that is needed out here. Otherwise, and the problem is what I say in that documentary. The documentary, BBC is a very strange organization. They are very nice and they have highly qualified people working there and make good progress. But then they call them public service. And when they made the documentary, they put it on the web and then they geo-block it for the rest of the world. A little like North Korea, but the other way around. And then after 1 month, they take it down. So Gapminder Foundation, who put lots of money into doing these documentaries, we have to pay ransom to liberate these programs. And then we do that, and then we put it up on our web. So it's free on our web, gapminder.org. But it's very good, and Wingspan, the team who makes them, that's just brilliant. You are just brilliant in London doing this. But that public service, that term has to be changed. It's more like BBC service than public service. So what we say there is ending this is better to do fast than slow. Better to do, because as long as we do it slowly, they keep doubling in 20 years. The population keep doubling here. So get it done fast. Get child mortality down. Get a slight improvement in productivity so they don't need child labor, and then give access to contraceptives. And you can end this in 15 years. If you do it slowly, it will just continue. So this is the problem is, when you put the question where the children are, it's also all these war zones. I mean, to that sad group of children not in primary school, we had to add a lot of Syrian children. And one of the reasons why we see refugees coming and paying such a lot of money to go on dangerous boat to Europe is that the children don't even get education in the refugee camps. Because the rich countries have not funded UNHCR. It's a shame beyond understanding. We haven't even given half the budget to UNHCR. And that's much, much less money than what we give to those refugees who turn up in West Europe. Well, you don't get them because you have a channel, but we have them. You have them in Calais. And Sweden keep receiving them. Sweden is now cutting down the aid to 25%. 1/4 of Swedish aid now is receiving refugees in Sweden. The government will probably cut away another 1/4 of Swedish aid, bringing it down to half because of the cost of the refugees in Sweden. That's a very shameful way of doing it. Because each Syrian refugee who come to Sweden, almost costs so much, so it kills about 10 children by cutting back on family planning, vaccines, and other things. And it's a very, very strange reallocation. And if anyone knows what accountability means, it means putting cost on the right account, isn't it? It's about bookkeeping. And claiming that it's development aid for the poor nations when you use it for ordinary reception of Syrians. And the Syrians are welcomed in Sweden. I've stood in our big hockey arena and I asked them welcome because they are doctors, architects, designers, and economists. It's the 3% most highly educated. It's a blessing to get all these people into the country. But we shouldn't use aid money for the adaptation. They will make a return in the economy very soon. So that's... it's very strange that money is not used more logically. We need a lot of data used back home also.
Very true. Now I had another question here on this side. Let me take...
Hi. Oh, sorry, I've got a mic. Is it okay? Hi.
Sorry, you just asked your question, I think.
No, I did.
Oh, sorry. Okay, go ahead.
Sorry. Hi, Harriet. I'm a student. I was wondering... Leave no one behind is a brilliant tagline, and I think NGOs and donors alike are all bought into it. But in reality, sometimes donors want to tackle areas where there's lots of people and they've got lots of quick wins and bang for buck. And I was wondering, how do you persuade people?
Well, I don't get it. Take the question clearly and use English, please.
Sorry. There's NGOs and donors, I think they agree with the tagline of leave no one behind, including those in the rural areas. But often people want value for money, and the decision makers would rather put a hospital in a city where they can affect lots of people's lives rather than near a village where they get 10 people rather than 100. So I was wondering whether
NGOs based in the rich countries run the risk of giving priority to disadvantaged people in upper middle income countries because they are easier to reach and easier to understand for those who give money to them. These people are difficult to understand. I didn't understand these people from data. I understood these people from doing field surveys during 20 years, 1 to 2 months a year. Becoming humble after 10 years when I understood how much these women understood, and really realizing that qualitative research methods were most important. Humbly sitting and listening when my African PhD students, when they interacted, and especially the females one, when they interacted with the other women here. That's when I started to understand. And this is not glamorous. It's much better to use that disprivileged people in the district center or somewhere else, and nothing is so attractive as street children in big cities, which is a problem. Which is, of course, is a problem. Many NGOs are doing fine where they're doing, but they're drawing away the attention from the poorest. Someone has to defend these people. Someone has to stand up and see and do it that. And that leaving no one behind, yeah, that's a nice phrase, but show me the numbers. That's what you showed in your report. It's not going that way, it's going right in the other direction.
Hans, would you level the same charge at official donors as at NGOs? In terms of ignoring the very poorest people?
DFID is one of the best donors we have in the rich countries. You are highly qualified. You have the benefit of a lot of qualified immigrants from across the world who know the context, and you have a tradition in Britain for bad and for good of working across the world and knowing other realities, which countries like Scandinavia don't have. Scandinavia is good for diplomatic negotiations and somewhere we have a very bold Minister of Foreign Affairs who tell the truth about Saudi Arabia, and we are proud of her. Perhaps it was not too wise to say it just this year, but still, so there are some things, which we can do profile, but you're quite good. You're quite good. DFID is quite good. So if you criticize DFID and make them better, the others have to follow.
Okay, I think we have time for a couple more questions. Let me move back to this side of the room. Lady here.
Thank you. My name is Antoinette Salah. I'm an agricultural consultant. Can you say something about the poorest of the poor, who are usually farmers and women, and very often they're very clever women?
And just here in front.
Thank you, Hans. My name's Andrew Lamb, and I'm an open data consultant with the World Bank. The implication of what you were saying about getting to areas like in those corners with roads and hospitals and schools is that we need a lot more emphasis on infrastructure in the aid sector, and a lot of NGOs aren't set up to deal with sort of engineering and technology. They're not. My question is, in my experience, there seems to be more data around health and around economics than there is around infrastructure and engineering capacity. Is that your experience as well?
Thank you. So,
those two questions are linked, because it's the women in those remote villages that do not have that infrastructure. And I don't have a graph for that, but I have an answer for that. Didn't I have that one? No, I took it out here. So let me leave it. It took me 10 years to understand that those women understood more than me. Instead of doing simplistic research and trying to tell things, there's such an idea that you should tell people in remote areas, and those women, and it's really women, because men often have left. Both bad men and good men have left, because if they're good, they try to earn something somewhere else to better the condition for the family moving or for going back with investments. But the only thing I can say, listen to them. Listen to them. That's the most important. And truly listen to them, not by forming a bingo business NGO or something, that has the interest, but truly listen to them. It was a great experience working with the Ebola epidemic. Those people, many of them in government, who had the ability to listen. That is important. And with infrastructure, yes, but we have maps. We can see where there's roads or not. And I think using the censuses and placing mapping tools will be more important as you go for the low-hanging fruit in remote areas and the higher-hanging fruits, in central areas. We have to know where they are. And that's a problem, because we have been basing the discussion of inequality on quintiles. And quintiles we use because we have national surveys, and we only know the child mortality and the maternal mortality for the country. And then we get the quintiles, those who have less schooling and so on, there, but we don't know where they are. And the Minister of Health in Tanzania told me years ago, I don't need any quintiles because they don't come with a director I can fire. You need information of that area, and you need to see whether that area is performing or not. So quintiles are fine, we've used them, but we have to move on. And then we cannot, in the remote areas, we will not get maternal mortality rates for districts. We will not get that. We will not get child mortality rates for districts. We have to look at coverage of delivery service. We have to look at coverage of vaccination. That we can get per area. And we can see where do we have people with no services. And I think much more focus on service provision than on human rights. Human rights is fine for Sunday. On Monday, you need budget and coverage.
Thank you, Hans. I'm afraid that's all the time we have for questions, but it's been absolutely fantastic. And just particularly, I've loved all the way through your emphasis on listening to people themselves and letting data tell people's own stories. I think, just personally speaking, one of the things that I'm proudest of at our data work in ODI is the huge survey that we ran with the United Nations, where we asked 8.5 million people around the world what they wanted out of in the Sustainable Development Goals. And the results of that survey have been used in the negotiations, an example of how you can use numbers and numbers about that very thing, about what people themselves actually want and how they tell their own stories to influence these outcomes. So it's been a fantastically interesting and exciting morning. I'm going to invite Kevin to come back to the stage to say the formal thanks from ODI, but from me and all my
Before
team,
that,
thank
just
you
one
so
mention.
much.
These cost about £50 each. Gapminder want to have them back. Your brain tell you that it's cell phones and you put them in your pocket and then you get embarrassed. Don't do that. If you can collect them in the line, so one of you hold them. And who is collecting them then on your way out? Over there, yeah. So you hand it out that, but you can already start it so one of you have all of them and put them on top of each other. It will facilitate them.
So Hans, could I maybe ask you if you could download the information to tell me how ODI staff members performed on that particular test? I'd be,
No. We have high ethical roles. We collect no DNA on them.
It's a pity. It's tough to thank you sufficiently, Hans. It was a wonderful presentation, and in which we all learned a great new word, factfulness, which will be appearing in ODI papers down the line. There's another new word that I'd ask you to consider, which is the verb Rosling, to be Roslinged. Which I would sort of associate with being confronted with the power of your own prejudices and misconceptions by an incredibly insightful and benign yet cane-wielding professor from Sweden. So just a thought.
There's a problem because Rosling in the Swedish language means the last breath before you die. Whereas my name is Rosling, which is a small rose. So that mispronunciation in English makes it useless. Please go for factfulness. Go for factfulness.
You know, there were so many things that came out of the presentation, which I'm not going to attempt to summarize, but I was very struck actually by some of the information that came out of the data exercise you did right at the beginning of the overestimation of the degree of extreme deprivation that you find. And it nonetheless does strike me that, you know, that when you went wandering off on left stage on the high-hanging fruit, there's clearly a huge challenge around this last 10% in education, the last 10% in vaccine. And the fact that we're seeing progress in many of these areas flatlining now, I think illustrates how hard going the next mile in development will be. And I think using all of the tools at our disposal to get a better handle on that is absolutely critical. And of course, it brings us into these areas of, you know, how do you deliver a decent quality health system, a decent quality education system in those four corners. And actually, this is one of the themes that we're really trying to focus on in ODI, so I'm very glad that you highlighted that. I also wanted to thank you for boosting, probably by a factor of several 100%, the downloads of our Financing for Development paper.
Financing for the future.
Financing for the future, I'm sorry.
Financing for the future. I even know the title.
God, this guy does his homework. I've been Rosling. It's actually a wonderful paper by Romilly Greenhill and Paddy Carter. So I would encourage any of those of you who haven't read it to download it and look at it. And it addresses many of the issues that Hans was raising here, in particular with the financing, from a financing perspective. We have a small, can I have the bag as well? We do have a small presentation. This, as Hans said, he gives this lecture to a lot of commercial banks. Yeah. And this is a bag full of dollars for you. Actually, it's not a bag full of dollars at all. But you actually asked us specifically for a particular book, which is on child labour during the British Industrial Revolution.
Yes, it is that one. It is the very book. Yes. Thank you. Thank you very much. Yeah. Thank you. You see what a fantastic country you can build with such terrible methods. It really gives, food for thought. You know, what nastiness, I come from one of the 22 countries in the world that was never occupied by Britain. The way you have been behaving to your own children and to the world, it makes you humble to criticize other countries too much when they are in the same period, And I'm very interested on this and how this could turn around completely, to the opposite. Thank you very much.
Well, I guess also, Hans, this is part of the last 10% challenge, isn't it? Because, it's one of the things that's holding back progress. The other non-monetary gift that we have for you is three of our top infographics, which we hope you'll find a suitable place for in your office.
Thank you very much.
So,
thank you.
Thank you. And thank you again, Hans, so much for a wonderful presentation.
Thank you very much. Thank you very much.
And thanks to all of you for coming. And please do link to us on ODI through the website and keep an eye on our future events. I can't promise they'll all quite be up to this standard, but they're pretty good. Thank you.